Hi, everyone, and welcome. Today, we're going to talk about neuro-affirming language and practice, what it means, why it matters, and how we can apply it in our everyday work. As mental health workers, we support people from many different backgrounds and experiences. Some of the people we work with may be neurodivergent, meaning their brains process information, learn, communicate, and experience the world differently. This can include people with autism, ADHD, dyslexia, Tourette syndrome, and other neurological differences. Many neurodivergent people also experience mental health challenges, often due to barriers, stigma, social exclusion, sensory overwhelm, misunderstanding, or difficulties accessing appropriate supports. By understanding neuro-affirming practice, we can provide support that recognizes and values these differences, rather than viewing them as problems that need to be fixed. The goal isn't to make someone appear more normal. The goal is to understand, support, and empower people to thrive as their authentic selves. Neuro-affirming practice is an approach that respects and values neurodiversity. Neurodiversity refers to the natural variation in how people's brains process information, communicate, learn, socialize, and experience the world. Rather than viewing autism, ADHD, or other neurodivergent experiences as deficits, neuro-affirming practice recognizes that people may simply experience and interact with the world differently. This approach focuses on acceptance rather than correction, understanding rather than judgment, strengths as well as support needs, adapting environments rather than forcing people to adapt, and supporting autonomy and self-determination. Neuro-affirming practice asks, how can we create environments where this person can succeed, rather than, how can we make this person fit into our expectations? The words we use influence how people see themselves and how others see them. Historically, many neurodivergent people have been described using language that focuses only on deficits, impairments, or problems. Examples include words such as high functioning, low functioning, deficit, normal behavior, problem behavior, obsessive interests, and poor social skills. While often used with good intentions, these terms can overlook a person's strengths, experiences, and individuality. Neuro-affirming language helps us move away from labels and assumptions and towards understanding the person. Instead of focusing on what someone can't do, we recognize both their strengths and their support needs. As mental health workers, our language can either help someone feel accepted and understood, or reinforce feelings of shame, exclusion, and misunderstanding. Let's look at some examples of how language can shift from deficit-focused to neuro-affirming. Example 1. Autism. Sarah suffers from autism. Sarah is autistic. Or, Sarah is a person with autism, if that is her preferred language. The most important thing is respecting the individual's preference. Example 2. Communication. Tom has poor communication skills. Tom communicates differently and may benefit from alternative communication methods or additional processing time. Example 3. Special interests. Emily is obsessed with trains. Emily has a strong interest in trains, which provides enjoyment, knowledge, and opportunities for connection. Example 4. Social interaction. Michael lacks social skills. Michael socializes differently and may prefer interactions based on shared interests, smaller groups, or familiar environments. Example 5. Sensory needs. Jessica is overreacting to noise. Jessica is experiencing sensory overwhelm and may need adjustments to the environment to feel comfortable. Notice how the neuro-affirming examples focus on understanding rather than judging. Neuro-affirming practice goes beyond language. It influences how we provide support every day. Some examples include supporting sensory needs, respecting different communication styles, valuing authentic behavior, offering choice and predictability, and building on strengths. Recognizing that bright lights, noise, crowds, smells, or textures may impact someone's well-being. Allowing extra processing time, using visual supports, or accepting alternative forms of communication. Understanding that behaviors such as stimming, fidgeting, pacing, or avoiding eye contact may help a person regulate and feel comfortable, providing clear information, visual schedules, routines, and advance notice of changes. Identifying interests, talents, and abilities rather than focusing solely on challenges. Understanding the impact on mental health. Recognizing that anxiety, depression, burnout, and emotional distress may sometimes be linked to years of masking, misunderstanding, sensory overload, or feeling pressured to fit into environments that do not meet a person's needs. The goal is not to change who the person is. The goal is to support them in ways that honor their identity and meet their individual needs. When supporting neurodivergent people, ask yourself, am I focusing on strengths as well as support needs? Am I respecting this person's communication style? Am I adapting the environment where possible? Am I supporting authenticity rather than conformity? Am I listening to the person's lived experience? Am I viewing differences as challenges to understand rather than problems to fix? Small changes in our language and practice can make a significant difference in how supported, understood, and respected someone feels. Thank you for watching. Remember, neuro-affirming practice recognizes that different doesn't mean less. By respecting neurological diversity, valuing strengths, and adapting our supports, we help create environments where neurodivergent people feel safe, understood, and empowered. Because true inclusion isn't about changing the person. It's about creating a world where everyone belongs. Different, not less. Support the person, not the stereotype.